We're live.
All right, great. Welcome everybody to our Let's Make Healthcare Happen Town Hall series. We're doing a virtual version of slides that we took all around the state of Washington last spring and summer. We had some really great conversations and folks shared some stories about their healthcare issues and concerns. And so we hope to do that again tonight and share a little bit about how we plan to fix it. So slide, please. So who am I? My name's Carey Wallace. I'm the board chair for Whole Washington. I'm a nurse by background. This is my contact information if folks want to get in touch with me. I've been a nurse for over 20 years. I'm currently not represented, but I am a dues-paying member of Washington State Nurses Association, as well as National Nurses United, because I believe in collective bargaining. I think the strong workplace democracy creates strong democracy in our country. And that's something we really need to focus on. And one of those pieces is organizing around the issue of healthcare. And so really proud to be volunteering for this organization and as well as supporting the efforts of nurses in this fight and in the federal fight for single payer. I've been a volunteer since 2016, 2017. I think I collected a whole 7 signatures on our first initiative and have grown to understand Whole Washington and the policy a little better over time. I was a signature captain for 1471. Andre's pitch around signature captains really spoke to me. And so I signed up right away and helped support a team in Cowlitz County gather over 2,000 signatures, which is difficult in a rural district like this. Little Red, my neighbors are. But healthcare is an everybody issue. It's my favorite part about organizing around healthcare is that everybody wants their mom, their grandma, their daughter, their son, their nephew to be taken care of and to not go bankrupt in the process. So we've been centering stories, so I'll share mine. Folks who are familiar with Whole Washington may have heard this, but apologies. It's really what keeps me going right now. My uncle died in March. He had colon cancer about 7 years ago and was received treatment, was in remission. He was taking a medication that was fairly expensive on a monthly basis, and that was keeping his cancer at bay. And then the insurance companies decided they didn't want to pay for it anymore. And so his cancer came back, his colon, it spread to his lungs. He had a tumor on his throat, and tried to teach. He was a communications professor on the East Coast, still working while he was receiving treatment for this new advanced cancer, whispering to teach classes and grading papers on his deathbed. He was dead within 6 months of that insurance company decision to stop paying for his medications. And so absolutely infuriating, absolutely tragic, absolutely unnecessary death, and not unique. Sadly, my family story is not unique. It's happening all over the state, all over the country. So really, truly reignited the fire to organize with Whole Washington. Happy to be here tonight. Slide. So who's Whole Washington? Whole Washington is grassroots, nonpartisan organization made up of regular working people. A lot of our leadership has a healthcare background. Kathy Angel was a nurse who helped found the organization. There's a lot of nurses on our board. You heard from Pam and Kathryn. And our overall goals are universal single-payer healthcare in Washington state. And then we hope to see, whichever state goes first, we can start a cascade effect across the country and end up with an expanded and improved Medicare for all system nationally. So that's what we're hoping for. Next slide. So town halls, we're doing town halls because this was a winning strategy that came out of Michigan. If you haven't seen Slay the Dragon yet, I highly recommend the documentary. They took on gerrymandering with their initiative process and collected 50,000 signatures in the first 2 weeks. They had 400,000 signatures almost 2 months before the deadline. And having done this 3 times and collected about 100,000 signatures each time, we really just connected with those organizers to find out what in the world was working for them. And that town hall strategy was one of the primary things they said helped to get people engaged, to talk about the policy, to get folks involved and excited. And they were starting from scratch and won. So we have some things on our side, our database, the experience from those previous initiatives. And then we're also very willing to learn from folks who've had success in other states on other issues. And stealing those ideas and implementing them here. So hopefully we can win on this issue here in Washington. Making sure people know who we are and what we're doing is a big piece. When we're out signature gathering, we don't want our volunteers to have to spend time explaining what is whole Washington and what are we trying to do. We're hoping folks will get excited though, oh, I know who you are, and just sign the petition, right? So there's a lot of work in the background to get to that space, and that's what we're doing here tonight. Also looking for open public discussion. We learned a lot from the road trip we took, and a lot of what we learned we implemented into the newest version of the bill, Senate Bill 5233. If folks don't know, it's been introduced again. And so really meaningful conversations lead to really meaningful changes in the bill language, and the same will be true of the initiative when we get there. Next slide, please. So yeah, I mentioned we want to repeat that success here in Washington, and we can. It's people driven. We can do this. We just need your help. Next slide, please. So what brings you here today? The room is full, but I would love to hear from 2 or 3 people about what made you sign up for our town hall today and what you're hoping to get out of tonight's presentation. Please do know that this is being recorded, so if you're willing to be a part of the recording, raise your hand and come off mute, and we'd love to hear your story. What brings you here today? Gregory, I see your hand. Go ahead. Thanks,
Can you hear
Cam.
me?
Yeah.
We can hear you.
Yeah.
Yeah. So I actually work in healthcare now, and IT for healthcare specifically. And I was sort of galvanized long before this when I lived in Nevada, turning the Nevada over to Bernie Democrats. And Bernie really galvanized me and, kind of opened up my eyes as to just how bad it is and how the system doesn't work and how the system is rigged, and why, you can't even get in states that are almost entirely controlled by Democrats, why you still can't get single payer health care because, for various reasons. And as seeing, the system just push people literally over cliffs, and only get worse. And, for years they argued, the numbers, and they said, oh, well, we've got the best healthcare and the best outcomes. And then it's just not the case. It was all a lie. I mean, they've shown the numbers now prove that we have worse healthcare, worse outcomes, worse finances from it. Every number, every metric that you can measure on paper or Excel or whatever is worse for us than any other developed country. So any argument they had is a lie and meaningless. By the way, I say they, and it was the people who argue against single payer healthcare and against universal healthcare. And the system is just breaking people, and I'm tired of seeing it happening. I will not stand by and watch people's lives get destroyed anymore and do nothing about it. I will always defer to the quote, the only thing that takes for evil to succeed is good men to do nothing.
Absolutely. And with that, the whole town hall in Gregory's comment. No, I'm kidding. We will definitely touch on a lot of those subjects. Thank you so much for being here. I see Jenny's hand and then Tom, and then we'll flip to the next slide. So Jenny, go ahead.
Hello, everyone. My name is Jenny. This is my first time calling into this group, so thanks for the work that everyone's been doing. I was diagnosed with stage 4 breast cancer in my 30s, and it is healthcare being tied to employment is really a struggle for people who can't work. And so that's something that's really close to my personal story at this point in time. And I've just met so many others through support groups and other things that I've been involved in since my diagnosis. So I want to do anything I can to help improve the system.
Great. Absolutely. Tom.
Tom Knox, Olympia. I'm a 30-year IBEW member, which means I'm middle-aged and starting to have some health issues, overweight, ruptured disc in my lower back. You know, currently actually on workman's comp on L&I and work from home agreement. But I still have other health issues that I had a couple of surgeries on my hand this year, and my out of pocket was, they tell you that you have a maximum out of pocket, and it was still $3,000 more than that. So, you know, I had my daughter broke her ankle right after the Affordable Health Care Act was instituted, and my out of pocket for that for just for anesthesia was $18,000, and I was able to negotiate with the clinic to about half of that, but still that was more than 3 times my out of pocket maximum. And so I just don't understand how the system is set up that, you know, we're supposed to have an affordable healthcare plan. Anyway, I'm preaching to the choir here, so I'll just make it really quick because I saw this on a Facebook page today and I clicked on the link, and I'm, you know, please look me up in the contact information. I want to get involved. I've quite familiar with knocking on the doors. I used to be involved with Building and Trades Council when I was much younger. Took a quite a long break from politics, but I'm willing to start banging on the doors and when it's legislatures in session. So
That's
we,
awesome.
you know, thank you, Carey.
Yeah, we have a slide on how you can get involved, and it's towards the end. So hang in there. And I put the volunteer link in the chat for now. Please do sign up to volunteer if you're interested in helping, and we'll talk some more about that soon. Thank you so much for sharing your stories. That is how we connect. We're going to talk about the facts and the figures and the things that Gregory was sharing. And the reality is our legislators know these things. And so it's really telling our stories and changing their hearts and minds that's going to make a huge difference in this movement. So slide, please. Great. So why do we need universal health care? We just heard a whole bunch about why we need universal health care. This slide shows Washington State and the different counties in Washington State. Someone mentioned we have the best health care in the world, and that's true if you can afford it. And so we know that social determinants of health, where you live, your zip code, can predict how long your life is going to be and how well you live your life, how healthy you are. And that's one of the main reasons as a nurse that I participate in this area of activism, is because that's just not okay. It's not okay that that's true in Washington. It's not okay that that's true in our country, and it's absolutely fixable. So next slide, please. And not only do we not get the healthcare we need, but we spend the most for it out of any country on the planet. And so this slide shows the cost of healthcare in the US compared to lots of other countries. And someone else talked about how, you know, even though we spend all this money, we're really not the best as far as outcomes go. So we're definitely not getting what we're paying for. And why is that, right? We'll talk about that. Next slide, please. So anyone here, raise a hands if you've ever worried about being able to pay for your health care. Just a show of hands. I won't put you on the spot to say anything. This is awesome. This is a huge issue. Even when you have good insurance coverage, there are costs associated with the care that you're receiving, even though you've paid into the system. Tom talked a little bit about, even though there's a maximum, he paid more than a maximum. I work for the state. I have really good state healthcare benefits, and my son had a surgery and for his tonsils. He had tonsillectomy, and our out of pocket was like $1,400 for that surgery, right? So even though I have good insurance, it's not well covered. Folks, if you want to lower your hands and share a couple stories about times that you've had worries about paying for your health care, we could take a couple of those stories right now. If anybody would like to share. Kathryn, go ahead.
Yes. Well, I can say that often I've had to, like, if I if I changed jobs or whatever, or even when I went back to school, I remember I went to the dentist because I had dental insurance, and tried to get everything fixed up. And then while you're in school, you're like super, super careful because you don't want anything to happen. You can't go to the can't afford to go to the doctor, So you just decide to take that risk yourself or not. Anyway, that's my story.
Yeah.
Yeah, good point.
Yeah.
Anyone else? Judy, please come off mute. Tell us.
Okay, here I am. So, 2017, I had a very significant bout of diverticulitis. I had to go to the emergency room, and it was a 4th of July weekend. I had no idea if the people that were seeing me or reading my CAT scan were in network. And so I had to go on Tuesday because Monday was a holiday. I had to go and call the insurance company, sick as a dog still, and ask them. Thank God I got their names, made sure I had their names. And I found out they were a network. And I mean, it was crazy that what they can do and how much they can charge. They charge $7,000 for a CAT scan. And I called the insurance commissioner, and they said, yep, they can charge whatever they want. So
Wow.
that was my story. Now I'm on Medicare with a high-end supplement, and I just had a surgery 2 years ago. The hospital bill was $125,000. I paid nothing.
Oh, wow.
Yeah, and there's a good why it's broken and how we fixed it side by side. Thanks, Judy. Pam, I see your hand, and then we'll move on. Go
Yeah.
ahead.
Okay, so I worked at a free clinic for 2 years, and I think it was about 80% of our patients were without insurance. Well, everyone there is without insurance. That's a qualifier to be seen at the free clinic. But my point being that a lot of the people that need those services they're falling through the cracks because their demographic is they make too much money to qualify for Medicaid, but they don't make enough to be able to afford insurance out of pocket. So they go without. And sometimes they have to wait 6 or 8 weeks to be seen at the free clinic. A lot of healthcare stories that I could share from my experience 2 years working there. So yeah, they just can't afford to pay for it.
Yeah, thanks, Pam. Thank you for sharing your stories. Next slide, please. Okay, so the Washington Health Trust is going to be better for individuals and families. It will cover folks who are in some of those coverage gaps, like Pam was talking about, folks who make too much money for Medicaid but not enough money for private insurance. It'll cover folks that are intended to be covered as part of the ACA expansion, where you can stay on your parents' health insurance, and at the same time, there's still a lot of 19 to 25-year-olds who have no insurance. It'll prevent us from filing bankruptcy for medical expenses. We are the only country on the planet, really, that has this problem of medical bankruptcy. We're using GoFundMe in a way that's not nearly as much fun as those creators had intended it to be. I know myself, I've donated to several GoFundMe campaigns for friends whose kids have had cancer. A girlfriend of mine recently, now they're starting to come up with different GoFundMe type products and organizations that are geared specifically towards healthcare. And I don't think that's the right way to go. I think we should cover healthcare. The interesting note on here about the RAND experiment that was done that found a 2% increase in copays resulted in a 10% reduction in utilization. That is great information if you're a health insurance company. If you know that you can nickel and dime people, create networks like Judy was talking about, where, it's out of network, so it's going to cost more money, so I'm going to be less likely to go. My copay's gone up, my deductible's gone up, all of these things where insurance companies just kind of nickel and dime us. Folks are less likely to go to the doctor, and that's not good for us. That's not a healthy, well way to live, right? No focus on preventative medicine and a huge focus on sick care that creates avoidable deaths preventable, treatable illnesses that are going completely unchecked. So the Washington Health Trust would cover folks and prevent a lot of these issues. Next slide, please. Is there anyone in our crowd tonight that owns a business and struggles to pay for healthcare for themselves or their employees? This is something we heard a lot about as we drove around the state last spring. Alexa, go ahead.
Oh, hi. Sorry, I'm actually at my store right now. We're about to close, but it's been a quiet day. It's fine. So I own a business. I have a store on Whidbey Island, and because I'm a business owner, my income like fluctuates. So sometimes we're because of expenditures, we qualify for Medicaid, but then other years we don't. And sometimes I've been like $50 too much in my annual income to qualify for Medicaid, and then I'm paying, $200 a month for my family's insurance. So it's that fine line, and then of course it's terrible coverage when we have to pay out of pocket, and it makes it so we go like as little as possible. So the years that business is a little slower, we end up having better insurance. And I have a 7-year-old, so I'm taking it upon myself as a mission to fix this broken system before he's old enough for him to get thrust into that. And I want to know that my employees have healthcare, even though it's not something that I'm able to provide as an employer. I want to know that they have access and they can go and be taken care of. And it's just the collective benefit. We also live in an area with a higher percent of senior citizens that struggle to make ends meet. And this is one way that we can help adjust the cost of living, is eliminating insurance. So that's my main reason for getting involved. And I'm looking to be like a signature captain or a lighthouse or whatever, a point that people can come and collect information and hopefully host like a town hall and that kind of stuff.
Yeah, thank you. And I think I recognize Foamy Waiter. I think you've hosted a bin for us before. Thank you so much.
Oh yeah.
David.
Yeah, I don't own a business, but I run it. Run a small steel detailing outfit,
Right.
and yeah, we don't have health insurance. It's just too out of control. So I do worry about my crew not going to the doctor and showing up to work, not healthy, not sharp, because I mean, we work on computers all day long, but still you need to be mentally sharp and pay attention and not be worried about what the hell else is going on, how you're feeling, how you're going to go to the doctor or whatever. And I am really, really tired of hearing from politicians about small business this, small business that. And the biggest thing that would help us is universal health care. I am just so sick of hearing about small business, this, that, and the other thing, because it's all bullshit until it comes down to healthcare.
Absolutely. Thanks, David. Slide, please. Okay, so let's talk a little bit about how the Washington Health Trust is better for businesses. So right now, most businesses who can afford to pay for health insurance for their employees are paying between 15 to 18% of payroll for those costs. We had folks come and tell us that is way not high enough. That is more like 22% or more percent of payroll to cover employee benefits. And the Washington Health Trust would significantly lower that cost. We saw during COVID the impact of healthcare being tied to employment. That was mentioned earlier by one of our stories. 55% of folks get their health care through their employer. And what happens if you don't have a job? What happens if you'd like to start your own business? What happens if you can't work because you're sick? And what we've seen is you pay into this insurance for your whole working life, and then when you really need it, it's just not there. And again, too many small businesses just can't afford to cover the cost, which also means they can't afford to compete when recruiting for talent with some of these other big corporations that can provide more robust benefit packages. So super important for small businesses. We have done a lot of work in this area with this most recent bill language. We've created a sliding scale for businesses, and we'll talk a little bit more about that. Some of that came from feedback, these discussions on the road. And so really important to keep engaged and watch as this policy runs through, and share with your local businesses, market streets, et cetera, on how this would benefit them. Next slide, please. This slide we use sometimes and sometimes we don't. I want to talk about unions. Labor is very important in the universal health care movement. Some unions stretch across states, and so talking about state-based programs can be a challenge, but we do have a sample resolution that's come out of our Single Payer Leadership Summit that we hosted in coalition with some other healthcare orgs in August last year. And it's getting some momentum. So if folks are union in the crowd and are willing to take that resolution to your union to consider, we've based a lot of the framing of this conversation around the labor campaign for single payer. We do have side by side how our bill compares to what the labor campaign for single payer has identified as needs for labor in a state-based system. And our bill does quite well in what that looks like. So willing to share all those resources. Unions in the United States talk about healthcare as one of the main draws to union membership. And this slide really illustrates that the US does not hold the kind of union power that we once did, and not nearly as much as other countries that do have a strong universal healthcare system. So encouraging unions to really think about what taking healthcare off the table does to their bargaining power. To be able to negotiate something besides healthcare benefits. When you sit down to the table, you get a lot farther on worker safety issues and wages, but the potential of bringing back true pensions versus the retirement packages that we have nowadays. There's some huge potential here for labor workers and unions to really think about. Next slide, please. So everyone has a story. We'll come back to this slide, but just illustrating all of the different kinds of impacts that having insurance companies mixed up in our healthcare is causing. We talked about medical debt, surprise bills because things are out of network and whatnot. We've talked about access issues. There are folks, as we were traveling around the state, talking about there's one eye doctor in our area and he's not in my network. There's one maternity provider in our area and that person's not in my network. And so folks are driving significant amount of distance and time in order to see certain specialty care providers. And that's just not okay. And it benefits all of us for the coastal towns and the rural communities to have robust healthcare systems in place because we visit those places. So even if you don't live in a rural community, understanding that those communities need things is one piece, and also understanding that you travel. You're going to be at the beach. If you break your leg, you're going to want there to be, an orthopedic surgeon there available to take care of you. So making sure the entire state is well covered is a community act, but it can also be a self-preservation act. And so no matter where you come from that lean, there's a lot of different ways to really promote this type of coverage. We also talked a lot about insurances for separate insurances for your eyes and your ears and your teeth, and the gaps that exist in the Medicare coverage, and how the Washington Health Trust can support filling some of those gaps. So we'll talk some more about that. I know folks have stories in all of these different areas around why, profit-driven healthcare is really creating huge negative impacts in our overall health and safety. Overall healthcare system. Next slide, please. And why is it so bad? We talked about how bad it is. Folks have shared their stories about how terrible what they've come up against. It's really big money in politics, and there's no one party that's not guilty here. Democrats, Republicans, Independents, they're all in the pockets of big corporations, really because of the impact of Citizens United. Insurance companies are absolutely profiting off of this. They're paid up front with our tax dollars, with our premiums. And the more they can delay our care, deny our care, they get to keep that money. So if their network isn't robust enough, that's your problem. That's not the insurance company's problem. And they get bonuses for keeping it that way. So seven health insurance CEOs raked in a record of $283 million in 2021 with all the quote unquote inflation over the last few years. I'm sure those numbers are much higher. And we've seen tragically the impact of that. The CEO of United Healthcare that was targeted. This is understandable rage. We're definitely not condoning violence, and we're really trying to give folks a better outlet for that justifiable anger around how our healthcare system is functioning. So getting involved in this movement, making real efforts towards changing the policy is a much better way to go there. The Washington Health Trust will give us some ability to negotiate med prices. We pay more than any other country for the same medications right now. It'll also give us some accountability over some of the private equity consolidations, acquisitions, and mergers. It will not directly address that issue. But we think starting by removing the health insurance companies is really a good first step. Washington State does have a cost transparency board, but I would argue no amount of transparency is going to solve the imbalances of market power that we're up against here. So start by kicking out the insurance companies. That's my favorite part of the Washington Health Trust, and then move on from there. Next slide, please. So the fix, well, let's talk about what the fix is. The Washington Health Trust will cover every resident of Washington State, that is regardless of citizenship status. That can be a sticking point for some folks, but we're trying to build a community here. Public health is a public health issue. It's public, right? The way we take care of our communities impacts all of us. What the Washington Health Trust does is puts you and your doctor back in the driver's seat. So we talked about networks. There will be no more insurance networks. If folks are covered by the Washington Health Trust, they're covered to use any provider they choose. In Washington State, they would also be covered if they are in Arizona for vacation, or in Philadelphia visiting family, or whatever the case might be. The only thing that's not covered is care outside of the United States. It'll give you the freedom to truly shop around. I know that universal health care is often tied to socialism, and really, if you think about it, this is true capitalism. If everybody's covered, if I get to choose which doctor I go to, that's really a more capitalistic standpoint. Coverage, it's fully comprehensive. The Washington Health Trust requires Washington State to develop a minimum benefits package that's the same for everyone, and is comprehensive. So it includes your eyes and your ears and your teeth. The Washington Health Trust would act as like a Medigap plan for Medicare. So your Medicare coverage would still cover the bulk of your health care. And then the Washington Health Trust would pick up those things that are traditionally covered by a Medigap plan or a Medicare Advantage plan. Medicare Advantage is still private insurance. So that's really been a loophole for the private insurance companies to steal money, not just from, before you retire, but also as your Medicare age. So at the same time, all of this, and we save $5 to $9 billion a year. Kathryn likes to point out that Gerald Friedman's studies show that we would save up to $13 billion a year, and why it's only $9 billion is because we do cover everybody and we cover a full comprehensive set of services. So anything that's medically necessary that a doctor prescribes is covered by the trust, and the trust just pays the bills. So that's the other piece. Doctors, nurses, clinics, hospitals are still private entities, making it not a true socialistic system. I'm mentioning this because you're going to want to talk to your neighbors and your family. And so covering everybody, but still providing that care through private entities, just paying the bills. A couple of times when we're on the road, folks asked, am I going to be required to get vaccines I don't want? We actually updated our FAQ to address that directly because the answer is still no, we're just paying the bills. So whatever you and your doctor decide is included in your treatment plan. That also means, though, that your insurance company is not there telling your doctor no. Doctors are spending a ton of time right now fighting insurance companies to implement their care plans. I don't know if you all saw, but just a crazy story about the doctor that was called in the middle of breast reconstruction surgery. United Healthcare called to make sure that that surgery was medically necessary in the middle of surgery, demanded that she got on the phone. It's just crazy. So it's time. It's time to get the health insurance companies out of our healthcare and make sure that everybody is covered. Next slide, please. So the Washington Health Trust, the language is linked in these slides. It's available on our website if you're interested in reading the bill. It's big. It's an 80-page bill. The point of this slide is it's built off of good policy, and it continues to be improved as years go by, as it evolves, as we collect more information. We did base this off of the Washington Health Securities Trust Bill, which is a Healthcare for All Washington bill. Healthcare for All Washington is also part of the Healthcare as a Human Right Coalition that whole Washington is a member of. We've also taken some inspiration from Bernie's original Medicare for All legislation and Healthy San Francisco, which is a model that's stood up so far to legal challenges around ERISA. I'm not going to explain ERISA, but it'll come up a lot, and you'll just know that the language of the bill is intended to support our being able to make it through those kinds of legal challenges. It's been vetted through Washington Employment Security Department and the Department of Revenue. We've requested a review from the Office of Insurance Commission. We're working really hard to make sure that this policy is implementable, and that it can be, just implemented and used. It's reviewed and refined prior to each submission. Talked a little bit about some of the stuff that we learned on the road and how those conversations have impacted Senate Bill 5233, and we plan to continue those conversations, and so that those improvements can be made for the next time we launch another initiative as well. How do we pay for it? Can we really afford this question comes up a lot. And so there are several studies on our website, 2 of which we paid for through Dr. Gerald Friedman, that shows that $5 to $9 billion savings I talked about earlier. And then there's also a study that the Universal Healthcare Commission, Washington State Universal Healthcare Commission, had done that shows $2.5 billion of savings in the first year. So imagine that's the most expensive year if you're going to try to stand up a new program and take down the old system and transition and all that stuff. It can be expensive. And still, we saved $2.5 billion. And that's something that I've really focused on in my letters to my representatives. While they talk about budget crisis and we don't have money for anything right now, saving $2.5 billion should be compelling. So we have an excellent FAQ page. When I've been out collecting signatures, I'm tabling those kinds of things, and people ask me questions I don't know the answer to. Most of the time, almost all the time, there's been an answer on the FAQ page. So folks that are new to whole Washington, please do find the FAQ page on our website and refer to it. All right, next slide, please. So what's covered by the trust? It's intended to be a fully comprehensive set of benefits to be modeled after union type benefits so that folks are truly covered. Inpatient, outpatient, dental, medical, vision, behavioral health care is included. And at the same time to be paid for upfront and not nickeled and dimed all the way through the system. So right now it's written with no deductibles, no copays. Networks don't exist, so there's no out-of-network costs. There are some coverage. So if folks want a a brand name medication where a generic exists, there are some out-of-pocket costs for that, but even that's capped out at $250 a year. All kids are covered. All kids are covered now in Washington State, but they would also definitely be covered by the Washington Health Trust. And I mentioned earlier that folks, if you travel, as long as you meet eligibility criteria as defined by the healthcare authority, you're paid into the trust, then you're covered if you're on vacation inside the US. At the same time, so we cover all these things and we still save $9 billion a year. So it's really a no-brainer.
Yeah.
Next slide, please. How we pay for it is exactly how we pay for healthcare now. There will be an employer contribution, there will be an employee contribution. Sole proprietors will pay in, and instead of that money going to insurance companies, it goes into the trust and pays providers directly. So we're just cutting the middleman out. Again, my favorite part of the whole bill. This slide is outdated. I mentioned we've done some updates with the Senate Bill 5233 that creates a sliding scale for small businesses. So they're paying up to 10.5%. Kathryn found some existing RCW that loosely defined what micro businesses and mini businesses are. And so based off of gross profits, they fit into a category and they pay a percentage, 10.5%, 6%, 4%, and down to that 2%
That
sole
would be on the
proprietor
next
piece.
slide, Andre, probably.
Nice. We'll
Yeah.
get there.
Yeah, right.
No, I don't think it is.
No.
Okay.
And then there is a capital gains tax in the current version. If you look up previous bill numbers, there's some hit pieces out there trying to say that we're coming after our houses and they're coming after our retirements. Those kinds of things are specifically excluded from the capital gains tax. This is not meant to be a working class tax burden. It's really meant to get folks who maybe don't have a traditional job and all they're doing is selling stocks to get those folks into paying part of the their portion of the healthcare trust. Next slide, please. We will have time for questions later. I'm going to keep going through. So the Washington Health Trust will save $9 billion annually. This is a breakdown of how those monies are saved. This comes out of Gerald Friedman's studies. The breakdown's probably different in that Universal Healthcare Commission study, but similar in the idea that you won't have to be administering insurance, right? So employers will save money around all of the work it takes to choose insurance providers and insurance plans and manage which employees on which coverage plan, and then also the same savings of time and money for the providers who are providing healthcare. We will have some market power to negotiate pharmaceuticals. Kathryn's mentioned that Gerald Friedman assumed Washington State population-wise is about the same size as the VA, and the VA tends to pay about 40% less for their medication. So we could see the same kind of reduction for Washington State just based on being able to negotiate those kinds of things and negotiation with hospitals and those kinds of things. So there's also the ability of fraud detection. If everybody's paying into the same pot, it's kind of easier to identify fraud. healthcare industry, I mean, is one of the most trusted professions. There's lots of really good players in this system, but there's also some things going on. And insurance companies don't tend to worry about that kind of stuff. They just pass those costs on to us. The Washington Health Trust would manage those kinds of things. So there is some potential accountability structures that come along with a single payer system like this. Next slide, please. So payment rates, this slide is something that's I've not presented before, I'm just being honest, but this is about that standard micro and mini business concept that I was talking about earlier, to show how those businesses would fit in based on the gross annual profit, and whether or not they qualify for an exemption based on worker salaries. We left it in the mini and micro and left it out of the standard in an effort to not have some kind of way that would be beneficial to keep folks at a lower overall salary, because that's not what we're trying to do here. And then employee contribution is starred because the employer could decide to pay all of the 8.5% or all of the 4.5% or whatever, but they also are allowed to delegate up to 2% down to the employee. Some businesses might choose to maintain that 2% to have a real strong recruitment strategy. Some labor unions might be able to negotiate for their employer to pay that 2%, but the Washington Health Trust bill language allows for that 2% to be delegated. Anything you'd add, Kathryn?
Just that also think about how the sole proprietorship fee is also a 2% excise tax, and that's 2%. So that's what they would be paying also. There's another slide where that shows that better. And the other thing too is, well, I'll save that for later. Go ahead. Next slide.
Sure. Next slide. Thanks. So this is that concept again, just spelled out in a different way, trying to show what monthly contributions might look like depending on how folks are earning in the state.
And Janet actually built this, and I just love it. It's great. I think we're missing a little bit here at that first 50. Oh, I know why, because the large businesses don't get that $15,000 exemption. You're right. So that's why it looks that way. But understanding that these larger columns, this is trying to show how we're trying to really make it on those smallest businesses, getting to have the least, they don't have to pay near as much. But understanding here, like in the orange column, that the final one, that $290,000, it's not going to take too many salaries of $290,000 before that business then moves over into the mini business. And the same thing there, that business is going to move over into the large business as that business grows. But it allows for those small businesses to provide health insurance that's got no copays, no deductibles, covers everything to all their employees at an affordable cost. And they're not passing that burden on to the rest of us anyway. You know, we're all paying fairly. And they all have better care, and they're able to start their businesses, grow their businesses, and hopefully get them to the level of being a large business. So that's all.
Great. Thanks, Kathryn. Next slide, please. So here's an example what those contributions would look like. An example as somebody who's making $75,000 a year, what those contributions would look like in dollar amounts, just to make it a little more tangible. Next slide, please. Okay, so I've mentioned the Universal Healthcare Commission a couple times. Our executive director, Andre Stackhouse, has presented to the commission on 3 different occasions. These links are live in the slide deck. We can share these with you, but this is also available on our commission's page on our website. If you're interested in more of the vision for implementation and a little more in-depth around how the policy works, I highly recommend the August 10th presentation. It's about 40 minutes long. It's very good. These are also really good resources to share with your legislators. It can be daunting to read an 80-page bill and you still don't get that vision for implementation. So sharing these types of resources can be hugely helpful. Andre was invited back in December of 23 to talk about eligibility. It's a short presentation for us. It's everybody. There are some folks on the commission that want to talk about not covering certain members of our communities. But for us, this is everybody. There's enough money in the system to do what's right by the communities and our neighbors. We also were invited back to the FTAC, so the Finance Technical Advisory Committee. It's a subcommittee of the commission to talk about financing. If that's something you're interested in knowing more about, if that's the type of question you're getting when you're out there talking about whole Washington, it's only 20 minutes. It's a good presentation. And then really want to come back to that point of centering our stories. The Universal Healthcare Commission hasn't been very productive in creating real policy change. They've not come out with really strong single payer recommendations for our legislature quite yet, but it has been an absolutely fantastic platform for this conversation and a really good place to tell your story. The Universal Healthcare Commission and the FTAC meet monthly, essentially. One of them meets 1 month and the other one meets the next month. Both of them have an opportunity to share public comment. You can do that via email. You can also do that by preparing a 90-second story. The live presentation of your story does seem to have more impact on that group. But if you're not, if you're shy, you can definitely contribute via email. Next slide, please. We have a commission team that's super willing to help you prepare for those public commentaries. If you're fill out the volunteer form, join us in Slack, and join that Universal Healthcare Commission channel. So question for the audience, has anyone here been impacted by hospital or clinic closures or limited access to specialty care? I mentioned a couple stories from our previous town halls. There was a gentleman on the east side of the mountains who couldn't get to his lung doctor during certain times of the year. It's a 2-hour drive on a good day, and if it's snowing, you just didn't get to go to the lung doctor. Super fun times. Anyone here? Raise a hands. All right, we've gotten shy, and that's okay. Next slide, please. Oh, Leah, go ahead.
Oh, she has a good question.
Actually, Larry had his hand up.
Oh, I missed it. I'm sorry, Larry.
Thank you. Yes, I am a senior citizen on Medicare now, but back in what was the year? Well, COVID caused me to lose my job. I was over 65 and was on regular insurance. I made the mistake of going on an Advantage plan. I was diagnosed with prostate cancer 16 years ago, been living with it, active surveillance, that's a different story. But the Advantage plan I was with was dropped by Optum, who bought up Everett Clinic and Polyclinic. And as a result of that, Optum decided that they would no longer deal with Regent's Blue Cross Blue Shield for PPO products, and they would only accept PPO Medicare Advantage plans that were sold by, you guessed it, their parent company, United Healthcare. Mm-hmm. So in one fell swoop, I lost my oncologist, my urologist, my family practice doctor, I mean, every single doctor, and I'm walking distance from an Everett clinic here in Shoreline. Fortunately, my cancer isn't spreading. I haven't needed any treatment, knock on wood. And so I lost all of my doctors. Well, I didn't completely lose them. I could pay out of network for everything. But fortunately, and I thank the state of Washington, we have provisions on, like I think only 4 states in the country that allow us to change plans. And I was able as of January 1 a year ago, I was switched into regular Medicare, at which point I got all my doctors back. That loophole, I was able to get in also without a medical audit or whatever the term they use to see about existing conditions, because they wouldn't have accepted me in if that had been in play. And that ended December of 2023. So I had one of those independent agents. They helped me navigate through. I got back into regular Medicare with United Healthcare, the company that caused all these problems. I stuck with them for 1 month because they were the only company that had dropped the requirement for a medical audit to check on history. They closed that loophole. So now there's no company that would allow me to do what I did a year ago. The healthcare trust would solve all of these problems. I don't want anyone to be faced with what I faced. I lived in Japan for a number of years, and the care there on their national healthcare system was awesome. That's another story. But yeah, I lost access to all of those people for a year.
That's crazy. Leah, did you have?
Yeah, I just had something real quick. So,
Great.
Recently we were talking, me and Steve were talking to our friend Robin White, who's Native American, and he was telling us that his mother lives on tribal land, and there's quite a few tribal lands that don't even have medical facilities on the premises, and they have to drive miles and miles to even see a doctor. And I didn't know that was going on right now.
This is Pam. Yeah, that does go on, especially if they're not federally, I believe this is true, that they're not federally recognized as a tribe, as a federal tribe.
Even the ones that are federally, yeah, unfortunately.
Yeah, and it's a horrible thing, but this is why this too would help. I believe, right? We can have them reach out to that too. I did have one person signing the petitions a few years ago that said, we do have tribal medicine, but we try to have another one in case they won't cover stuff. So it's it's incredible.
Thank you. Slide, please. So, one of the things that is possible with the Washington Health Trust that's different than how we're doing things right now is the possibility of global hospital budgeting. So global hospital budgets can be used actually for hospitals or community clinics. So some of those specialty needs that are not available in certain areas, some of the reasons why they're not available is because they're not making money, right? So the clinics that aren't running in the black often get shut down. And then it's difficult to recruit to certain areas because they're not paying doctors enough or whatever. And so global hospital budgeting allows a facility to set their budget and to submit it to the state to be covered by the Washington Health Trust so that services are available in the area, medically necessary services, regardless of their ability to run in the black, right? So a little bit of what we talked about earlier about, you're going to travel to the beach, you're going to go to the mountains, you're going to go to rural communities, and having medically necessary services available in those areas is good for those communities, and it's good for folks that are traveling around the state. So this is something that some states are doing already. So it's a component of some Medicaid programs. The state escapes me off the top of my head right now. I think it's Connecticut, somewhere over in the New England area. And so there's pieces of this that we're doing already that we've proved have worked. It's saving money, it's improving access to care, and something that we can initiate as part of the Washington Health Trust as well. So really important pieces of healthcare foundation. Next slide, please. This is a slide I stole from the League of Women Voters website. I think it's really important in certain parts of the state in particular to think about what the opposition is going to say about the Washington Health Trust and state-based single payer, and then have some talking points ready about why it isn't what the propaganda says it is. So I like the words inoculate yourself against misleading ads. These ads are put out by groups that have vested interest in keeping things the way they are. The insurance companies, pharmaceutical companies, private equity groups are making billions of dollars off of the mess that's our healthcare right now, and they'd like to keep it the way it is because it's benefiting them. So they're going to come out against us. If we collect enough signatures, if we get to the ballot, we are going to be hit with millions of dollars in attack ads that use these type of, this propaganda has worked in the past. It'll work again if we let it. So talking about what single payer isn't, it's not a public option. It's not Medicare for some, it's not Medicare Advantage. We talked about how that's private insurance. It's not socialized medicine. It absolutely will be, we're just paying the bills. It's not government run. This one's tricky. Folks are like, it's the state level, the government can't do anything right now. It's not everybody, but there's folks out there who think that. So talking about, what's available as part of the accountability structure for the Washington Health Trust. It's publicly funded, it's privately delivered, but there's also boards that are created that help create accountability to the trust itself. There's a citizens oversight board. Providers are involved in setting service rates and those kinds of things. Right now, they have no say. So even though the prices of medical care have gone through the roof, providers really aren't seeing any of that increase in their pay. So just talking about, what this does, creates one large risk pool. I've described it to folks as, think of it as like a big GoFundMe account, right? So why are we comfortable using GoFundMe, but not a state-based healthcare trust, right? And it really covers everybody. It creates a community resource that's available to everybody and cuts that private insurance for-profit piece out of it. Nobody likes their insurance. Red, green, blue, purple, whatever your political background is, everybody has had a very unpleasant experience with their insurance if they've really had to use it. So just talking about those types of things, we need to be ready to have those conversations. So hopefully this slide is helpful. This conversation is helpful. Next slide, please. So coming back to that, everyone has a story. We do have a few minutes if folks who haven't had a chance to share yet or have something else to say, to talk about some of the other issues that are happening in our healthcare. And then we do have some time for questions and some action items. And because we're recording, we probably will take questions more than once. I'll take questions during the record, and then I think I saw Andre say in the chat we could probably take some time post-recording for folks who want to participate and aren't comfortable being on camera. Any hands to share a story about any of the other issues that are happening in our healthcare right now?
I thought I saw somebody, but I don't
It
know.
was Gregory, but he put it, okay. Oh,
Go
there's
down.
Jennifer.
See Jennifer.
I have a
ahead.
question, not a
Oh.
not a story to share. So sorry. Go ahead,
Oh.
Jennifer.
Thanks,
Thank you,
Gregory.
Greg.
I just wanted to say, I just heard about you guys yesterday, which is really exciting. I'm a primary care provider in Spokane, and basically I'm just sick and tired of having to treat each patient differently when they walk in the door based on what insurance they have and what I think their out-of-pocket will be, what is covered, and what medication I might be selecting, or what specialist I have to send them to. And that's taking up a huge portion of my day when I could actually be spending talking to my patients and talking about preventative health and giving good advice instead of sitting there playing Tetris with what I'm going to prescribe for them that day or how to get them an MRI or something like that. So I'm really excited that this is happening.
Yeah, awesome. Thank you for that
Thank you,
perspective.
Jennifer. Yeah.
Absolutely. Glad you're here. Tell your friends. Leah, I see you have your hand up again.
Well, a little bit about my background is we've actually been without insurance for a couple years in between jobs and stuff. But also, I'm getting a little tired of every time I get it. My company just switched over to United Healthcare, so I'm a little worried about that. But every time we have a broker come in our building with new insurance, I don't know how many times you guys have had to hear this, but always stay in the network, always stay in the network. And the problem with staying in the network is if you go to your doctor's office, if they're a lab there and that goes to somewhere else, you don't necessarily know if they're in the network. And we've been stuck with bills because of one test or one blood test, and it not being in the network. And my husband had to have an EKG, and whoever did it, it wasn't in the network, so it cost us $1,500. So I don't know how people feel about that, but that's one of my stories that I get.
Yeah, absolutely.
Very
Even when you're
disappointing.
doing it right, you're doing it wrong. You can go to an in-network hospital and end up with an out-of-network ED doctor. Yeah.
They
Yeah.
also don't tell you that a lot of the ambulances aren't in the network, so it
Oh,
costs us
sure, yeah.
$3,000
It's
for an ambulance going from one hospital to the next, and you don't really have a choice when that's happening.
yeah.
Thank you.
Aruna. Thank you. Aruna.
Thank you for very informative presentation. My question is one of the slides with League of Women Voters. This is a government-run program, right? It would be going to the trust, and trust is administered by the Washington state, right?
The trust would be administered by the boards that are created, yes, but it's not like the NIH or the NHS. I mean, that is the doctors are employed by the government and the nurses are employed by the government and the clinics are
Right.
owned and run by the government.
Okay.
So
Okay,
there
so-
is a bit of a distinction.
Yeah,
Yes.
I think if you can clarify that, that would be helpful because, partially it is run by government. It is administered by government, but it is delivered by the healthcare providers
Right.
individually.
Yeah.
Right.
So yeah, administer. And what I had recently heard was that in California, this universal healthcare or single payer system was defeated in court or something. Is that
Oh, yes.
a wrong information or is it? I don't know. I'm
California
confused.
hasn't gotten far enough for
Yeah.
it to go to court as a state. The Healthy San Francisco language did hold up in court. To the ERISA challenges that it experienced, but following National Nurses United and their work on AB 2200 in California, it sadly didn't even get as far through assembly as it did in previous attempts. So it got pulled before a hearing in the previous attempt, and in this time around, it didn't make it even as far as it did last time. So California Nurses Association and National Nurses United has done a lot of work in that area, but there's a lot of money up against, politicians doing the right thing right now. So great question. Pam, go ahead with your story and then we'll move on
Thank
to the
you.
next slide. Yeah.
Yeah, really quick, just this business of coverage being tied to your employment. I think that's really been a struggle throughout my entire life. That has been so frustrating to know that you're going to lose your provider, that you spend this time trying to find a good provider and that you have a connection with, and all of my different family members, spouse and kids, you switch jobs and suddenly you have to find a new provider. And that's happened so many times to me, and it's just wrong,
Yes.
Thank you. Kathryn, I think you have your hand up and I'm going to give you privilege as vice chair to speak before we move on to the next slide. Go ahead.
I just, Aruna had said that we needed to clarify, so I did want to clarify on that government-run issue. It's just the trust that is being administered, the same thing that, the same way that our health insurance, for-profit health insurance companies, they don't really provide any health care. Those are all through private entities, the doctors and the hospitals and such. The insurance company is who's paying the bills. So instead of our for-profit insurance companies being the one responsible for paying the bills, it would be the nonprofit trust that is administered through the state, right? So, okay, but it's not government-run health care. It's just government-run healthcare financing.
That's a good point.
Okay.
Yeah. It's important to have this conversation now because we're going to get hit with you. Perfect. Next slide, please. All right. So, one of the things you can do right now today that will help us is to pledge to sign the next initiative. So this QR code should function to go to the pledge to sign. You can also go to wholewashington.org, and it's one of the 4 buttons on our homepage. Andre put the link in the chat. Please do sign the pledge. Please share the pledge to sign. We're targeting 50,000 pledges as part of our GO criteria before we launch the next initiative. We've collected 100,000 signatures 3 times. We've had some really great support from different organizations. And so trying to get all of those 3 different campaigns pulled together into one, and make sure that we really can support what it takes to collect 400,000 signatures statewide. Other things that are part of GO criteria is monthly recurring donors, making sure we have enough money coming in routinely to pay for staff to support our volunteers. We're looking for folks who have signed up to volunteer and have trained and they're ready, active volunteers, a certain number of active volunteers. We're also looking at regional and county leads, so having enough folks that know enough about whole Washington and the policy to answer volunteer questions in their area. So if you're the lead for Cowlitz County, for instance, then volunteers who come in new to Cowlitz County could rely on you to answer some of their questions rather than bugging Andre or myself or Kathryn all the time. We do a lot and we're happy to take questions. There's only so much one person can do though. So trying to really build the capacity for volunteers to have what they need when they need it, by building up some leadership in the middle. And then money in the bank, right? So having enough money to fund a true campaign. Washington State hasn't had a successful initiative that didn't have some component of paid signature gathering. So really trying to make sure that our budget includes those types of components that'll make it successful. We've done a lot on a shoestring budget with all volunteers 3 times in a row, collecting 100,000 signatures, and not the same 100,000 signatures 3 times is really very impressive. But we also have a lot to lose at this moment in time. So just making sure that we have built the kind of support and foundation and framework that's required to have a successful initiative run. So next slide, please. I see your hands. I think we're almost to the place for questions. Aha, they are, yes. Okay, so Gregory, I know that your hand is out of order, but you raised it earlier, so please feel free to ask your question now. And then Aruna, you're up next.
I'm just curious what this does specifically with regards to Medicare Advantage, because obviously if we're kicking out the insurance companies, there is no Medicare Advantage from them. So does it switch automatically everyone in the state to Medicare, or does the trust implement its own form of Medicare Advantage?
It's a really good question. So what the trust would do in regards to Medicare is function kind of like a Medicare Advantage plan, but the money doesn't go to a for-profit insurance company. So just like that financial distinction Kathryn was making earlier, the trust would cover healthcare services that are not covered by Medicare. So eyes and ears and teeth, which is crazy that, as you get older, you definitely might need dentures and glasses and hearing aids, but those things aren't covered, but they would be covered by the trust and they would be covered in that same kind of capacity. But again, not managed by a for-profit company that's pulling dollars off for their shareholders and whatnot. Aruna, go ahead. Are you able to come off mute, Aruna?
Aruna, you have to hit the mute button at the bottom left of your Zoom screen to come off mute.
Well, while she's looking for that, can I just clarify your answer to the last question?
Yeah, please. Go for it.
So, and actually initially regarding Medicare, it would start out initially as just being a secondary Medigap plan, right? And then it would cover whatever Medicare didn't cover. And then through the transition process, and a lot of that regarding Medicare would depend on getting waivers and that kind of stuff from Medicare in order to be able to convert it more to like a Medicare Advantage, because that's the way we could save the most money. Or a Medicare Part C plan to be official about what it actually is. We don't know that we would ever get there, but we know we can be a Medigap plan. So a lot of it going further down the road is completely dependent on the federal government doing what they need to do to allow that. And there's other organizations working on trying to make that a reality also. So.
And I'll
Okay,
just
thanks,
add,
Kathryn.
because someone had said, would the current Advantage plans, would they have to pack up and leave? And I think the answer is no. But if the state did have so if the state was able to get a Medicare Advantage, effectively a public option on the Medicare Advantage exchange, that would allow Medicare enrollees to voluntarily enroll, and they would have the choice of the other Medicare Advantage plans. But I think the state, as the administrator, would be in a position to, for instance, default people into the state's plan, for instance. And then to speak to the federal waivers, right? So we could put a Medicare Advantage plan, a public option on Medicare Advantage, and that would require some federal cooperation. But the ideal way to integrate Medicare would be through a federal waiver, at which point we kind of consider Medicare fully integrated into the Washington Health Trust. And at that point, there would be no more Medicare Advantage component in Washington. Medicare Advantage would still exist in other states.
Right.
And it can function without ever going there too. That's the nice thing about the way to trust. Okay, Arun, I think you've been able to come off mute. Go ahead and ask your questions.
Yes, this is Prakash and Aruna together here. So
hello.
Hi. The question I have, I'm sorry I joined a little bit late. So the question I had was, if this bill passes, will the employees in Washington State be still required to pay the FICA tax?
Yes.
Yeah.
They would. Okay. All right. That clarifies for me. Thank you.
And just to take it a little bit farther, right? It's because it doesn't replace Medicare, right? So a huge amount of the medical dollars that are covering people in Washington would still be Medicare dollars.
Yes.
And of course, it doesn't do anything to touch Social Security.
No, that's right. Yes. Thank you.
Thanks, Andre. Dawn Smith, it looks like you were next.
Yeah, okay. So a couple questions. First one, I mean, whether insurance is government run or privately run, or whether it's just single pay where the government just handles the finances, there are difficult decisions to make about rationing care. You can't pay for every care. So I presume boards do this. I mean, it says, for elderly people especially, someone has to decide what's covered, what isn't, and what the pricing is. Can you go a little into that? And the other question maybe is, is there a way to gracefully transition private insurance companies to like be part of this, or do they just cut out and replace completely? Which may be the right thing, the right way to do it, but maybe they could be used somehow to help administer it.
They're not going to leave gracefully. They're not going to leave gracefully. I guarantee that.
Can I try this one though?
Yeah, please, Andre, go ahead.
So actually, the transition plan does not immediately kick out private insurance or anything like that, and mostly it provides an alternative, right? So employers who have self-funded employer-sponsored plans would actually be able to maintain those plans, and that is because that is ERISA, which we haven't gone into too much detail, but federal regulation basically means that we can't take those plans away from employers who are offering those. But what we can do is we can give employers a much cheaper, much better plan that they don't have to administer. We can also allow individuals to choose to enroll, right? And so even if the employer is not widely offering the plan to their employees, an employee who wants to be covered by this could self-enroll. And ultimately, some of this actually could be administered through nonprofit health insurers, right? So if the state chose to contract through a private insurer, that's something that they could do in the beginning, but the intent of the transition plan is that ultimately this would be kind of fully financed and administered by the state. And so, in that sense, right now the state contracts through a couple of private insurers for its Medicaid program, for instance, right? And the Washington Health Trust doesn't say, well, the first thing you have to do is fire those insurers. So Medicaid would continue, and it continues in the way that it is right now. It would raise the reimbursement rates. It would raise the eligibility so that more people can enroll. But the intent of the design is to, as much as possible, move towards a fully integrated state administered insurance plan. So I think that is kind of the way we see the transitioning and the way that private insurance gets handled. On the question of, rationing, I think that, the intent of the bill is written is that medical decisions would primarily be made between patient and doctor. We create a governance board, and that governance board does ultimately get to make decisions about the coverage package. It has the ability to enact price and cost controls. The solvency of the board of the trust is the primary responsibility of the board. But in that sense, things that aren't covered, right, are things that private insurance may continue to cover. We intend for it to be comprehensive so that that is not generally necessary or appealing to most people. But I think that's also maybe one reason why we don't take over the whole thing, is because what we're trying to do is say, we have made a plan. It is comprehensive. It is run and funded by the state. But we don't force anybody into it. And that's important because we really think that in order for this to succeed, it's something that people need to understand is offering value that they can't currently get from their private insurers.
But a rich person will be able to buy extra great insurance or just pay a doctor more. I mean, there's no way to stop that, I presume. Although in some countries maybe they do, but that's not the intent of this, I presume. A rich person could pay as much money as they want to get a great medical care.
I believe that is the case, yes.
Thanks.
I can't really stop that. Regarding though, some people are worried about there'll be long lines or longer lines than we currently have. And when you look at when other countries have put systems like this in place, initially there are longer wait times. And that's usually because there's so many people that have unmet healthcare needs. I mean, though it usually lasts for about a year and then things mellow out because people really do have other things that they would rather be doing than going to the doctor.
All right, I see Randy and then Larry and then Christelle. And then we probably need to get to the actions piece, and then we can take some more questions after we've talked about how you can get involved. Go ahead, Andre.
Oh, I was just going to say, because we're at 7, if we should stop the recording and take the rest of the questions off record, or if you wanted to finish this portion and the actions and then take it off at that point.
I think we need the actions included in the recording, so we can pause on questions and do that and come back to questions.
Let's do that.
Based on time? Okay, let's do that. We will come back to questions. So slide. And thanks for your patience, guys. So how you can help. We talked about lots of different ways you can help. Signing the pledge to sign our next initiative. One of the things that in the pledge to sign does, aside from letting us know that we're ready to go, is also show the support in the movement to our legislators. So we can use the past signatures in certain areas of the state. We can use current pledges to sign as kind of a poll to share that information, that data with our legislators, with certain legislators in certain areas, to show the support that's in their constituency. So this pledge to sign is easy and super valuable in all of those contexts. If you don't already get our newsletter, please do go to wholewashington.org and sign up for our newsletter. Jen does an absolutely fabulous job. She has some other supports as well, but that'll keep you updated on what's going out. And if there's any urgent call to actions, they're going to go out on that newsletter. So Monday we had our lobby day, and on Tuesday we sent an urgent action out to folks asking them to call their senators to co-sponsor Senate Bill 5233, and that is how you get included in those urgent actions. So please do sign up to our newsletter. Sign up to volunteer. I think we put that link in the chat a couple times. That'll get you in our system. That'll give you some more information about how to get more directly involved, to get inside our Slack, to get connected with folks who can answer your questions directly and help you start organizing your communities. Last Saturday, we had 3 different local community meetups happen, one in Clark County, one in Cowlitz County, and one in Whatcom County, and just starting to talk about, how can we collect signatures in our areas? Are there businesses willing to host petitions? Are there folks that we know that would be interested in helping us gather signatures? Are there folks that we should be talking to now? Because it can take time to build those relationships and the trust and to get all the questions answered. And so ensuring that we have those connections starting to be made now is how we're going to be ready to collect signatures if we do launch in March. Plan to attend or host an event, something like I just talked about. Nothing happens without money. Whole Washington is nonpartisan, so we use Act Blue for folks that lean blue, and we use Anadot for folks who lean more red. There's not really a good nonpartisan fundraising platform, so we use the ones that everybody's using. What else? Call and write your representatives. Please do submit public comment for the Universal Healthcare Commission. If you sign up to volunteer, we can help you learn how to do that and connect to the Universal Healthcare Commission and or the FTAC. I think Kathryn put in the chat there's an FTAC meeting tomorrow. And sometimes the FTAC is a little less formal, and sometimes they will ask folks if they have any public comments, whether they've signed up to give public comment or not. So no promises, but if you're not busy tomorrow at 2 o'clock and you want to listen in, typically the public comments at the front of the meeting, but not always. So you might be there for the whole meeting, but really a great way. And again, our legislature knows. They know that we'll save money. They know it'll lower the tax burden for working class Americans. They know it'll improve outcomes. There's a lot of money, a lot of people lobbying to keep it the way it is, and we have to be louder than those lobbyists. And sharing their stories is how we connect and really change hearts and minds. You can subscribe to announcements from the commission, so you get those reminders about those meetings. National Nurses United has been hosting a Patients Over Profits pledge. The intention of that pledge is that folks that are elected or folks that are running for office pledge to not take more than $250 from the medical industrial complex, if you will, to really try to target directly that big money in politics issue that we're seeing. And then we're featured in the Healing Us documentary. This is one of those things that's an organizing tool. We have had movie nights and had folks get involved because the stories are compelling. It's not just Whole Washington's story. There's stories coming out of Nevada and all over the country. Wendell Potter, who used to work for Cigna as their spin doctor, talks about what was really the final straw for him, working in and supporting the insurance companies in America. He also talks about the propaganda, that those Canada waits a long time. A lot of that stuff is just false information that's been shared. And I would argue we're waiting longer than Canada right now. My husband's specialty appointment took like 8 months. And we wait because they keep our money. If they were paying monthly premiums and it takes us 8 months to see a doctor, they just collected 8 months worth of premiums. So If some of the whole Washington folks want to put some links in the chat for people to make it easier to sign up to volunteer and whatnot, that would be great. Maybe a donate link would be awesome. Next slide, please. Okay, so our go, no-go criteria is something we've been working on for a while. We've been trying to vet it through folks who've run successful initiatives in Washington State, and just want to make sure we start to articulate what this looks like. Right now, it says pledge to sign in 2025 all over our website, and that is our goal. That is our intent. That's our hope. If folks spend the time, spend the money, get involved, then we absolutely can launch initiative in 2025, targeting the 2026 ballot. The 2026 ballot is going to be more favorable for a progressive cause like this, but again, healthcare is an everybody issue. So the reason why we need things is to support that 400,000 signature gathering. Signature gathering is hard work. It takes a lot of effort, and the more framework we have built, that many hands make light work concept is what we're targeting here. So I talked about some of this earlier. I'm not going to read this whole slide to you, but consider pitching in and where your talents might be best fit to help us get this through the legislative session. But the backup plan is the initiative process. The no-go criteria, we talked about, how far could the legislature take this where we might consider holding off on an initiative? This is still up in the air. Some of us really think that if we meet go criteria, I don't care how far it's gone in the legislature, we might still hit go because we clearly show that we can and we should, and this seems like the right moment in this movement. But that's not a decision we make lightly, and it's not a decision we make unilaterally. So decision hasn't been made, but how far could it go through the legislature where we might consider holding off? That's yet to be seen. But what we look for in readiness has been clearly defined. Next slide, please. Oh, I should mention, we have two opportunities to go to hit the 2026 ballot. Initiative to the legislature is an easier signature lift. It's a longer signature gathering window. It starts in the spring where people are outside. Much better if we meet go criteria before March 1st. There's another opportunity in December, but it's cold outside. The signature gathering window is shorter. We would definitely need to pay people and more people to help us. So if we had a hedge fund manager backing us like those other initiatives did, we know that he spent about $1 million per initiative collecting those signatures. So we know you can do it with money, but to do it with volunteers and to do it in volunteer climate. Yeah. I don't understand your question 3, Kathryn.
No, it was in response to Dave's.
Okay. All right.
Maybe he
Okay. So trying to make it simple, break it down into small pieces. If you can give $10 today and tell 10 people about what we're doing, sign the pledge, share it with 10 people, that makes a huge impact on how we can meet those go criteria. We will be sharing out information about both strategies, both the legislative strategy and where we're at with the legislative session and Senate Bill 5233 and our readiness for initiative signature gathering. So please do give $10. Monthly recurring donations are much appreciated. Tell 10 people we can do this. Next slide, please. All right, another plug for the funding piece. Whole Washington is holding our first gala. We're booked for May 17th. We've got space reserved, and really looking forward to this event. It should be a ton of fun. We're going to be selling tickets soon, so save the date, I think, is the primary goal of this slide. Save the date for May 17th. Be at the Mount Baker Community Club up in the Seattle area. Next slide, please. All right, so thanks for attending. A reminder to stick around if you have questions. We'd be happy to stick around and answer them. We are on all of the social medias, so please do find us on your favorite one and share our content, like our page, those kinds of things. It does help get the word out. It's an easy thing to do while you're on the couch later tonight. Next slide, please. All right, I think that's it. So if we want to go back to questions.